My name is Tom Ebinger and I'm one of the hand surgeons here at Steindler Orthopedics. I recently started my practice here at Steindler and I'm from the eastern Iowa area. So today I'm going to talk to you about carpal tunnel syndrome. It's one of the most common conditions that we see as hand surgeons. What carpal tunnel syndrome is, in layman's terms, is basically a pinched nerve at the wrist. The name of that nerve is the median nerve, and it runs through a tunnel right here at the wrist joint along with the flexor tendons, which are the tendons that bend your fingers. In that tunnel, the nerve can become pinched, and the symptoms that might give someone would be burning, numbness, and tingling in the fingers. Carpal tunnel syndrome can happen in a wide range of ages. It can happen in males or females, slightly more common in females. People who have jobs or do a lot of activities with repetitive heavy gripping or grasping or very repetitive motions also are at risk to develop a carpal tunnel syndrome. There are two major ways in which a carpal tunnel release can be done. The most common way is called an open carpal tunnel release. A small incision at the base of the palm. And what we do is release the ligament that's putting a lot of pressure on the nerve. And so as the nerve runs through the tunnel, if we open up that tunnel, that will take a lot of the pressure off of the nerve as it runs through the carpal tunnel. Second technique, which I also do, is called an endoscopic carpal tunnel release. And that involves an incision a little higher up in the wrist. It's a slightly smaller incision. And we insert a device inside the carpal tunnel that has a camera on it. And looking through that camera, we can see the ligament that's causing pressure on the nerve. And the device has a small knife in it that we use to then cut that ligament. And again, same concept, open up the carpal tunnel and take pressure off of the nerve. There are advantages and disadvantages to each of those two procedures. The purported advantages of the endoscopic carpal tunnel is slightly less incisional pain and also some would say a faster return to work. But either is a very acceptable option, and the recovery for each of those is relatively minimal compared to some other surgeries. After surgery, the patient could expect to have a minimal amount of pain, mostly for the first day or two. Other things that they have to be careful of after surgery are keeping the incision clean and dry for about 2 weeks in order to let that heal. Once the stitches come out at 10 days, we put some protective strips over the incision, and the patient is back to doing most of the things they would do on a day-to-day basis, with the exception of heavy gripping and grasping or anything that's going to put a lot of pressure over the palm or the incision. Most patients find the recovery from that surgery to be pretty simple.